Pancreatic cancer remains among the most aggressive malignancies and one of the hardest to catch early, and its footprint worldwide keeps growing. Recent international data sets indicate that global cases have climbed by almost 12% over the last 10 years, with annual deaths now topping 460,000. Even with numbers, this stark public understanding lags, and many people fail to link subtle everyday symptoms to a disease that can be life-threatening. As a result, diagnoses often occur only after the illness has advanced, when effective treatment choices are far fewer. Emerging research shows that a cluster of early warning signs may surface as soon as 4 to 7 months before a formal diagnosis, opening a crucial window for intervention. Yet the pancreas sits small and deep in the abdomen, so tumors can expand and disrupt essential tasks like blood sugar regulation and the production of digestive enzymes without setting off obvious alarms. In the first part of this series, we examined several of these quiet but meaningful clues. Now we turn to the remaining indicators, many so routine that they are easily dismissed, which studies suggest could point to pancreatic cancer at a stage when it is more treatable. By recognizing these signals and not brushing them aside, you can greatly improve the odds of earlier detection and better outcomes for yourself or someone you care about. 1. Left shoulder pain. Beyond the more familiar abdominal and mid-back discomfort, tumors that arise in the pancreatic tail can create a distinctive pain pattern that often slips under the radar. Growth in this region may compress or irritate key nerve pathways, including the phrenic nerve and visceral nerve branches, serving the abdominal organs. When that irritation occurs, the pain signals can spill over beyond the abdomen, producing soreness in the left shoulder or a vague, hard-to-localize ache along the left side of the chest. The danger lies in how easily this is misread as something else, such as cardiac issues like angina or routine musculoskeletal problems of the shoulder and back. Many people attribute it to posture, a strained muscle, or a heart concern, and end up visiting a cardiologist or orthopedist long before anyone considers the pancreas as the culprit. That detour can buy the tumor more time to advance quietly. A useful clue is the character of the pain. Pancreatic cancer-related pain is typically deep, dull, and unrelenting. It does not settle with rest or by shifting positions. In some cases, it intensifies after eating or when lying flat, and may be paired with a heavy pressure-like sensation deep in the chest or upper left abdomen. Connecting unexplained left shoulder or chest pain with possible pancreatic involvement, especially when it appears together with warning signs like unintended weight loss, loss of appetite, persistent bloating, or dark urine, can open a crucial window for earlier evaluation. Acting at this stage improves the chances of finding the disease when more treatment options exist and outcomes are more favorable. 2. Persistent loss of appetite, anorexia. Among the many shifts this disease can set in motion, a sustained decline in appetite is both quiet and perilous, and it is frequently dismissed as something trivial. This is not a bout of picky eating or a brief stretch of undermeals. Deep inside the body, pancreatic cancer can scramble the hormonal cues that signal hunger to the brain. At the same time, smoldering inflammation releases chemical messengers that blunt interest in food even as energy stores dwindle. For many, the change arrives so gradually it hides in plain sight. Days slip by, meals are skipped without concern, and portions contract until a few bites feel sufficient. A puzzling early fullness, trouble swallowing, or a persistent indifference to food replaces the comfort and satisfaction eating once provided. Meanwhile, the body bears the cost without adequate fuel, weight drops, muscle strength fades, and nutrient reserves erode, leaving a person less resilient in the face of illness. This symptom becomes even more worrisome because it rarely travels alone. Nausea, altered taste, unrelenting fatigue, and ongoing bloating may join the picture. Considered one by one, they can seem benign. Taken together, they trace a pattern that should not be ignored. Recognizing these changes for what they may signify is not alarmist. It is a way to act while meaningful options remain, preserving the opportunity to intervene earlier and improve the road ahead. 3. Persistent nausea. When nausea or vomiting lingers for days or even weeks without a clear explanation like food poisoning or a brief stomach bug, it can signal a deeper problem. In pancreatic cancer, especially when growths arise in the head or tail of the gland, the tumor may press on the duodenum or partially block the upper digestive tract. That narrowing slows the passage of food from the stomach into the small intestine, so contents sit longer than they should. The result is an ongoing sense of queasiness, and for many vomiting soon after meals. These episodes often intensify following high-fat foods. Fat digestion demands ample pancreatic enzymes, and when a tumor disrupts enzyme production, the process bogs down. The stomach then faces both mechanical obstruction and impaired chemical breakdown, creating a buildup that heightens nausea and the urge to vomit. Research published in 2021 in the World Journal of Gastroenterology reported that nearly 4 in 10 people with advanced pancreatic cancer endure prolonged nausea or vomiting, frequently paired with average weight loss of about 8 to 10% over 3 to 6 months. The trap is how easily this symptom is confused with everyday issues such as gastritis, reflux, or simple indigestion. Yet when repeated nausea and vomiting occur even after small meals and travel with weight loss fatigue or a fading appetite, they should prompt swift medical evaluation. Imaging and diagnostic tools, including ultrasound CT and MRI, can help uncover what lies behind these changes. Identifying the cause sooner opens the door to earlier intervention, a moment when available treatments tend to be more effective. 4. Rapid, unexplained weight loss. Weight can fluctuate for many reasons, but when pounds fall off quickly without any change in diet or routine, it is a warning sign that deserves urgent attention. In pancreatic cancer, the drop on the scale is not only about eating less or having digestive upset. It often reflects profound metabolic shifts driven by the tumor itself. Cancer cells consume extraordinary amounts of energy to fuel growth and survival, pushing the body to raid its own reserves, first fat and then muscle. At the same time, pancreatic disease can derail normal metabolism, especially the breakdown and use of fats and proteins. When a tumor hampers the pancreas's enzyme production, nutrient absorption falters, and a person can slip into malnutrition even if food intake has not changed. The result is a striking change in body composition. Muscle mass withers, the layer of subcutaneous fat thins, and a gaunt appearance can emerge over a short span of time. Research reported in the Journal of Cachexia Sarcopenia and Muscle indicates that more than 80% of people with pancreatic cancer experience substantial weight loss, with many shedding over 10% of their body weight within just 3 to 6 months from the onset of early symptoms. This rapid decline carries serious consequences. It weakens the immune system, reduces tolerance to therapies, and slows recovery. For these reasons, sudden weight loss without a clear explanation, especially when it shows up alongside fatigue, loss of appetite, or new digestive changes, should prompt immediate medical evaluation. Acting quickly helps identify the cause and creates an opportunity to intervene, while treatment options are still more effective. 5. Sudden blood sugar imbalance, new onset diabetes. The pancreas is the body's command center for glucose control, producing insulin that shuttles sugar from the bloodstream into cells for energy. When a tumor develops inside this organ, that control can falter, leading to unexpected swings in blood sugar in people who previously had no problems. In many instances, individuals suddenly present with elevated glucose and receive a diabetes diagnosis, despite lacking typical risk factors like obesity, poor diet, or a strong family history. This shift occurs because the tumor can injure or impair the beta cells responsible for insulin production. As insulin output falls, blood sugar rises quickly, bringing symptoms such as excessive thirst, frequent urination, unexplained weight loss, and persistent fatigue. Less commonly, the tumor disrupts other hormone-secreting cells, provoking episodes of abnormally low blood sugar that can cause intense hunger, trembling, sweating, a racing heartbeat, and even dizziness or loss of consciousness if not addressed promptly. evidence underscores the connection. Research reported in Lancet Oncology found that roughly 1 in 4 people with pancreatic cancer were diagnosed with diabetes within the 6 months preceding their cancer detection. This pattern indicates that the abrupt onset of diabetes, particularly in adults over 50, without obvious risk factors, is a meaningful warning sign that warrants comprehensive medical evaluation. Recognizing irregular blood sugar as a potential clue to pancreatic disease can open a door to earlier diagnosis, a point at which therapeutic choices are broader and outcomes are more favorable. 6 swollen lymph nodes. Although the pancreas lies deep in the abdomen behind other digestive organs, pancreatic cancer can produce visible changes in seemingly distant areas such as the neck or the region just above the collarbone. When malignant cells detach from the primary tumor, they can move through the lymphatic system, the body's immune transport network, and seed lymph nodes in those locations. As involvement progresses, the affected nodes enlarge and become noticeable to the touch or even in the mirror. These nodes are often firm, smooth, and painless, with a tendency to increase in size over time. A classic example is a lump above the left collarbone known as Virchow's node, long recognized as a warning sign for cancers of the digestive tract, including the pancreas. Clinical observations indicate that the emergence of such nodes frequently signals a more advanced stage of disease, suggesting that cancer cells have begun to spread to distant sites. The risk is that painless swelling of a lymph node is easy to dismiss as a minor reactive change or mild inflammation. If you detect a persistent firm lump in the neck or above the collarbone that continues to grow over several weeks, particularly when accompanied by unexplained weight loss, fatigue, or changes in digestion, it deserves prompt medical evaluation. Identifying the cause early in these situations can help clinicians determine the source and begin treatment before the illness advances further. 7. Pain or heavy sensation under the right rib cage. In certain cases of pancreatic cancer, especially when a tumor blocks the normal flow of bile, the liver can enlarge as bile accumulates. That swelling does more than raise internal pressure. It creates a recognizable discomfort high in the right abdomen tucked beneath the ribs. What may begin as a faint ache or slight tightness can evolve into a steady sense of weight, as if something solid is pressing from inside. Because the liver and gallbladder share nerve pathways with nearby structures, the discomfort is not always localized. It can track around to the back or climb into the right shoulder, which makes it easy to misinterpret as a muscle strain, a pinched nerve, or a joint issue. The sensation commonly intensifies after fatty meals or when lying on the right side, positions that naturally increase abdominal pressure. Many people notice that this ache or heaviness arrives alongside hallmark features of bile duct obstruction, including yellowing of the skin and eyes, dark urine, and light-colored stools. When these signs travel together, they suggest something far more serious than ordinary indigestion or tension in the abdominal wall. Getting prompt medical evaluation at this point is crucial, both to identify the cause and to open the door to more effective treatment, while meaningful options are still available. 8. Ankle and foot swelling. Puffiness around the ankles or across the tops of the feet can look like a simple reaction to long hours on your feet, hot weather, or everyday tiredness. In the setting of pancreatic cancer, however, it may reflect deeper changes inside the body. As the illness advances, digestion and nutrient absorption often falter, and levels of albumin, the key blood protein that helps keep fluid within the vessels, can fall. With too little albumin, fluid seeps into nearby tissues, and visible swelling develops. A growing tumor may also disturb liver and bile duct function, slowing blood flow through the portal system and making it harder for blood to return to the heart. Together, increased venous pressure and reduced protein levels encourage fluid to pool in the lower limbs under the pull of gravity. This swelling typically begins around the ankles or the tops of the feet, feels soft to the touch, and may leave a temporary indentation after pressing. It tends to be more noticeable late in the day or after prolonged sitting or standing. Over time, it can climb up the legs, creating a heavy, uncomfortable sensation that limits movement. The concern rises when edema appears alongside other clues such as jaundice, persistent fatigue, sudden weight loss, or diminished appetite. Unlike swelling from more routine causes, edema related to pancreatic cancer often does not settle quickly with rest or leg elevation. Recognizing this pattern and seeking prompt medical evaluation can be pivotal, allowing clinicians to identify the source and begin treatment before the condition advances further. Silent is the label often given to pancreatic cancer, yet the body usually sends quiet signals long before the point of no return. The real task is paying attention, understanding that what seems like a small shift can be a vital alert. Each sign we explored in this series can change the course of a life when recognized early and addressed without delay. The sooner the disease is found, the wider the range of effective treatments and the better the prospects. If these insights have helped you see pancreatic cancer differently, think of how many others could gain the same clarity. Sharing this information is more than passing along health advice. It may offer someone time, hope, and a real chance at survival. Take a moment now to subscribe to our channel and enable notifications. Together, we can keep bringing forward practical, life-saving guidance and ensure these early warnings are not overlooked. Your awareness today could be exactly what helps someone catch it tomorrow.